India's COVID-19 vaccination drive is set to receive a 660 million dose boost. It's the largest procurement to date by the government. Most will come from the locally produced AstraZeneca shot. Officials warn severe shortages in some states could leave millions vulnerable. Prime Minister Narendra Modi has called for urgent action to fend off a possible third wave. While daily cases have dropped to their lowest in nearly 2 months, progress has been uneven. 6 states are actually grappling with a worsening outbreak. They account for around 80% of recent cases. Neha Punia joins us live. Neha, India is still far from reaching its vaccination target.
Absolutely, Stephen. When you look at absolute numbers, 7 months since what is being touted as the world's largest vaccination drive was launched, India has administered nearly 400 million shots. Now, that's a huge number, but here's the context. India's eventual target is fully vaccinating nearly 1 billion adults by the end of this year. And to meet that gap, it only has 5 months. And this massive vaccination drive, though successful in large parts, has also run into several stumbling blocks, primarily of vaccine hesitancy and shortages. While officials are working to counter hesitancy on the ground, especially in rural India, the problem of vaccine shortages is one that they've not been able to fine-tune entirely yet. We've seen several times in the last few weeks, several cities suspending their vaccination drives briefly because there simply weren't enough shots available. The government says it's working to fix that, and this massive order it's just placed is a step in that direction. These shots will become available sometime between August and September, and eventually the government says it will have its hands on 2 billion vaccine shots by the end of the year. But time is of the essence. There are warnings of a third wave, and the virus has already started to mutate. So the concern is a large part of the population still remains largely unprotected.
And Mr. Modi warns that the country is now at a critical juncture.
Absolutely. He's held 2 crucial meetings this week, Steve, both with regions that have seen a huge spike in cases. We saw how dramatic and catastrophic the surge in cases during the second wave was in the months of April and May. But even as the second wave is on the wane, it's not entirely ended yet. And we are alarmingly seeing a surge in cases in some regions, particularly in the northeast and in the southern part of the country. And this is the region that Prime Minister Modi addressed today. These are chief ministers. He's warned them that your states, including the state of Maharashtra and Western India, account for 80% of all the cases India has recorded in the last few weeks. And his message was simple. You cannot think that the virus is behind you. We've not won this battle yet. We cannot make the same mistakes we made before the second wave, when lockdown restrictions were lifted far too soon and people lowered their guards, which is why he said that while you cannot possibly impose a full lockdown in all regions, micro-containment zones are the way to go. You must continue to test, trace and vaccinate. He's also urged states to use the time between now and the beginning of the third wave to ramp up healthcare infrastructure, and particularly sent out a warning to these regions as well that we need to ensure that children are protected during the third wave. There are some concerns among the medical fraternity here that children might be vulnerable whenever a third wave hits the country.
Okay, thanks very much for that, Neha. Neha Punia speaking to us from New Delhi.